Good morning, everyone. It's a real pleasure to be here and an honor to come back to IIT after so many years. And Professor Balakrishnan and Radha are here in the audience, so that first of all an honor. And I've never given a talk in front of Professor Balakrishnan, so a little bit anxious, I must say. Hopefully, I'll do okay. But thanks so much, Sayan and others, Ravi, to have organized this. And I also got a chance to meet Pratap, who I knew from Los Alamos times, and only yesterday I realized that he's the dean here who is going to talk about and open the session. So with that, let me start. I've kept the talk at a high level. I'm not, 20 minutes, so we'll not go through any details, but hopefully I'll tell you the kind of work our group does and motivate the kinds of questions, because my understanding from Sayan is that there is a deep interest at IIT to start a center for epidemic modeling, and my goal is to try and motivate the importance of it. I come from a computer science background, but I think the topic really spans almost every technical area. Before I start, I want to thank the group and the funding agencies who have been so kind to fund us. Many of my colleagues, Arvind Srinivasan, for instance, is a part of the team that works with us, whom you folks might know. And I've included some references as well. So just to let you know, the way we have approached this is, we think to understand epidemic science, modeling is needed, but I think models go beyond just predictions. This is one of the things I want to first of all highlight. I think models are used to do multiple things. One is to synthesize available data to produce a consistent representation, provide a range of interpretations, evaluate them, monitor the impact of interventions, and coordinate understanding among stakeholders. So before I go into the COVID work that we did, I want to tell you that I came to this topic when I was at Los Alamos, and in fact Radha was visiting that time, and we wrote this paper. Los Alamos is a very strong group in nonlinear sciences, and we were looking for ways to apply the things that people had done there in the context of a socio-technical problem. And after the 9/11 event, we worked on a problem that was posed to us on understanding a bioterrorism event, and that led to our first paper in Nature, where we took a social contact network to understand how contagions would spread on it. After that, we supported the federal agencies to help them make a plan for interventions in case of an influenza pandemic in 2005. And that led to a very interesting idea on targeted layered containment. Later on, we worked with the DoD during the H1N1 pandemic. And before COVID, one of the things that we did quite intensely was supporting the DoD and agencies for the Ebola outbreak. And it was quite exciting and very satisfying in some ways. So today I'll talk a little bit about COVID. And first and foremost, I don't think people here probably need to know or to be convinced, but this pandemic was not a single pandemic, at least the way I see it. There was multiple ways. Each of them was different in its form and shape. Social events were a big part of it. I mean, in many ways, I think folks now agree and understand that if we all stayed at home for a period of time, we possibly could have completely stopped the pandemic. But that's not what happens for good reasons. And so, just as much as you want to study the biology, you want to study the sociology of the disease too. And I've tried to explain here the various waves that went on and the various factors that affected the outcome. So on our side, since we've been working on this, we constituted a group in about February of 2020, and we've been working ever since trying to support various agencies in the US. In our efforts. In fact, we work with Rajesh here at IISc very closely in the forecasting effort. We also have a NSF project jointly with him. And I think one of the interesting parts here is that we have worked very closely with the policymakers. The science had to be done in conjunction with them and in quasi-real time, which I think is quite different and difficult oftentimes for us as scientists. So let me in just a few slides outline how we have done this, and it's a very high level summary of the way we approach the problem. We can talk about it in detail given that the time is short. We'll leave it to a high level discussion. But generally, epidemic science has been studied using what's called the ODE models, or compartmental mass action models, and it's been very, very successful. And I would argue that it's been very successful during this pandemic as well. But it also has certain potential weaknesses or drawbacks, one of which is that it ignores the heterogeneity of the population. Heterogeneity in every form, the social contacts people have, the individual behavioral choices people make, the interventions that are not regularized. So the approach we had taken back from our Nature paper was to argue that maybe we want to represent epidemics as a reaction diffusion process on a network itself. And the question then came about, how do you have these networks, right? Nobody gives us these networks. Here a network is a social contact network. Each vertex is an agent or an individual, and two agents are connected if they have had a social contact, a contact that is good enough to move the disease on that edge. So it's a hypothetical mathematical representation. Such a network technically doesn't exist. So one of the first tasks, and this is something we've been doing for a long time, is to build a realistic network of a city or region of interest. And the way we do it is we try and take data from census, we try and take data from trip diaries, we take built location infrastructure, and essentially synthesize this information to build a network that is statistically close to the region that we are studying. I would be the first to argue that this is ongoing work even after 20 years. There is nothing what I would call a perfect and the final network. The more data you get, the better network you make. The idea is this network hopefully represents the city or a region, but it really preserves the privacy of individuals. So I do not want, say, Pratap as and details of him in it, or Ravi or myself in the network, but we want somebody like this in the network, so that the normative policy that you derive from these simulations is still meaningful without really addressing specific individual level issues. And then once the network is made, we would build out what's called a live twin. So now the term people use for these networks is a digital twin. It's a digital twin of the social contact network. But to understand diseases, we want to make this twin live, which means we want to take into account the current conditions on the ground, things like the specifics of the disease model, the interventions that are ongoing, case data, who is taking vaccinations, and essentially integrate into a large machine learning and modeling framework to do this. And then one combines all this to build these massive multi-scale simulations that we've been building for a while, and then studying how the disease would spread on it. To give you a sense, at least as a computer scientist, many of you might, an audience, especially the students, come from computer science background possibly. It produces very interesting instances of very large computations. So to give you a sense for the kinds of computations we do, this would be simulating all of US in very detailed manner and would produce data for 3,000 counties for a typical case study. And one of the innovations that we ended up doing because of the work during COVID was to try and combine, or at least be able to use two supercomputers simultaneously, because it turned out that after the first few months, nobody was willing to give us dedicated access to these supercomputing systems, right? Because there are other computations to be done. So you want to develop this scheduling process where you can harness the cycles that you have available. So let me tell you what this was used for, so that I think that gives and set the stage for the challenges, and then I'll end, Ravi, so that we can have a discussion. So the group very early on started making decision support systems, because we felt we wanted to reach the masses, and the only way to do that is to build these decision support apps. So one of the first ones we built was the one in the middle here. This still is active. It's a very similar app to the Johns Hopkins app, which essentially does nothing more than combine all the available data, processes it, and tells you where the state of the epidemic is. Now, initially we had a lot of people use this. In fact, the number of hits were very high. After that, we moved into building another app that told our state and then nationally the resources in the medical side that were needed and project them for the next 3 to 4 weeks. We also did a dashboard for vaccines there are lots of models that go behind it, and we'll discuss this later if you want. And one of the things we did with our colleague Yuri Leskovic at Stanford was to allow our state to build a dashboard where they could essentially play with various interventions in terms of closures and social interactions. So at 5 minutes, I'll try to.
5-minute warning. I just asked you to stay close to the mic. So
oh, okay. Sorry. Okay. Sorry. I thought I have a 5-minute warning already. So let me try and tell you some of the studies we did. And I think I want to highlight this because if you're going to set up a modeling center science, then we want to work with stakeholders. And it's somewhat uncomfortable to do science in real time, right? We were used to doing the science, checking what we've done, and only then publishing it. But waiting for this oftentimes is as bad as not doing the work in many ways. The group actually did fairly well. We played a fairly visible role for our state. We are the lead modeling group for the state. And we do about 6 presentations every week. One to the governor's office, one to the Department of Health, one to the hospital administration, and one to the state and local epidemiologists across the counties within our state. And then 2 bespoke modeling like studies. And this has been going on now since about April, May 2020. So 150 plus presentations. Many of them are open. The state puts out a report every week, which is available to everyone. And it also causes a lot of media hits. Some of them are okay, but some of them are challenging to deal with too, because this, again, as we discussed, was not a straightforward case. But it is important to engage the media. Not engaging was not an option too. And I think Gautam and many others, Rajesh certainly has engaged, and Sandeep, maybe you did it too. One of the success that I want to highlight early on was work we did on establishing field hospitals. And we were asked by the state whether they should establish hospitals, because if you all recall, in New York City, the case numbers had risen significantly, and they had opened a field hospital at the Javits Center, and they had also brought in a Navy ship, if you recall, because they were worried that the numbers are going to grow. And we were asked whether similar things is likely to happen in Washington, D.C. So we did 2 things. One, we did early modeling using ODE style models, and the models repeatedly showed that we're not likely to need such field hospitals in our state right away. So we told them that we don't think we need it. But furthermore, we felt that to the extent that they want to establish field hospitals, our experience at Ebola pandemic suggested that they should establish what we call mobile field hospitals, so that they could move from one area to another, so because the epidemic itself doesn't stay at one place, and that would make the use of these facilities easier. And finally, we had told them to establish them near hospitals themselves, because logistically it turns out to be easy. They asked us, we asked them, how long of a lead time do you need in establishing these hospitals? It turned out they needed, because the National Guard was deployed, about 6 weeks. So from then on, every week we give them a 6-week projection of what the numbers might look like. That's the hospital demand dashboard. And our state luckily has never had the need to establish these hospitals. Other states, Texas, needed them for a while. But I think that was a success story for computing and data science in terms of supporting a public health policy, and it saved a fair amount of money as well. We also did another study for them, which had to do with vaccine distribution, which we can talk about later. There are two hubs that CDC has established. Many of you might have heard about it. One is called the Projection Hub, and this is different from what's called the Forecasting Hub, but it was recognized very early on in the US that one model is not the right approach to this. In fact, I would strongly support that a single model use is not the right way to do this. No models are correct. The physics of this is hardly understood. In fact, I would argue is a complicated issue. Different models make different assumptions, and generally people have seen that ensembling these models, just like weather, turn out to give better results on the whole, not every time, but oftentimes. So CDC established a projection modeling hub, different from a forecasting hub, and the idea was that every month or so, these modelers come together. There are about 9 of us, 9 teams, and we are told to study a counterfactual. We would study right now, for instance, immune waning in the population and couple it with flu outbreaks as well. We have studied vaccine allocation questions. We have studied questions related to various closures. And it would relate back to typically a 4-cell design, and we would tell what would happen. The models are then put together into an ensemble and the results are presented. And this has been very successful. We have actually supported the CDC senior team all the time. This is always shown to them, and also to the COVID task force in the US. Now, decision making is not in our hands. It's really to provide them the scientific evidence so that they can make decisions. So right now, boosters are a question that is being studied in the group. A similar hub was established for forecasting. Back in 2010, as a part of NIH MIDAS program, we and other groups started this forecasting hub at CDC. And the idea is that teams again come together to forecast the disease dynamics. And I would argue that it's not a good idea in this case to forecast beyond maybe first 3 to 4 weeks at best, because things change on the ground. This has been very successful effort, and also effort that shows the limitations of the models at its current stage. Almost all models failed during the surge phase of these epidemics, okay, and when they came down fast. So it's not like we understand everything, but nevertheless, it's the case that ensembles almost always did better than any single model. Secondly, I think that the team has been formed so that over a period of now 10-15 years, assuming this thing stays and the funding sticks around, then we would be able to hopefully do better job, which is also encouraging new data sets to be gathered. So I think personally, and Rajesh has been spearheading this in India, I think some of you have probably participated, but our group and Rajesh's group has started a site with the goal that people in India can participate in a hub like this. And I'm hoping that this would be a successful effort, because I think this is a perfect thing to do within the Indian context. And we can go beyond COVID to address flu and other infectious disease as well. And it will take time to build it out, and this is probably a good time to do this. 2 quick slides and we'll stop. We are part of a viral and bacterial resource center that NIH had established almost 20 years back now. This collects almost all the bacterial and viral genomes that NIH funds to sequence. And a lot of interesting work has happened, a lot of bioinformatics gets done in this. And recently, just 2 months back, we were awarded a grant along with 6 other institutions or groups of institutions to set up what's called the Genomic Centers of Excellence. The idea is that you collect data, wastewater data, data from individual samples to do situational assessment, genomic assessment of what the state is. And it's not again for one virus. Hopefully over time this will grow into a larger group. So Ravi, how much time do I have? I will quickly, 10 minutes. Okay. So I want to move to the second phase of the talk, because as was asked of us, I wanted to identify a few challenges that we want to address if you want to set up a center of a kind. First is a data challenge. I don't think so anybody, at least who have done modeling in this area, needs to be convinced that data is on one hand a lot, on the other hand very little. Even so, even after the fact that we've collected data for such a long time, it's very noisy, time lagged, non-stationary, and I think the new part, which is that it needs to preserve privacy of individuals. Important that people, it's a social data set. So I think methods that have been developed recently in computer science under the umbrella of federated learning or differential privacy are likely to be very useful in this context. Computing is another challenge. As I said, we have been lucky to get access to 2 big machines, one at Pittsburgh Supercomputing Center and one is a local machine which has about 10,000 cores. The Pittsburgh Supercomputing Center was available to us every night for about 4 months, and that has got about 30,000 cores, and yet we were not, it was not enough to do this computation. So US has started to think about a national strategic stockpile equivalent, like the oil stockpile, that think about machines that then can be given to folks. But we need both, the resources and the software systems to be able to support this kind of effort should a pandemic happen again and in a meaningful way. The real-time requirements are really crucial here. The third challenge that I feel is important to address is a scale challenge. These problems have multiple scales. They're just part of defining this problem. Scales within how the disease progresses within your body, the changes the virus undergoes, your immune response, all the way to your social contacts, and all the way to interactions between people within a community, within a region, and across nations itself. So multi-scale, multi-theory simulations are absolutely central to this effect. The other challenge that I want to highlight is inequity, governance, and social challenges. As we discussed before briefly, this is not just about spread of diseases, but a social problem too, right? We have to manage this as a part of a larger issue, and I think all of you would agree that pandemics or almost all disasters preferentially hurt people of the weaker section of society far more, and this happened during this pandemic as well. And I think we need to understand this is far better, and I think methods could be developed. Logistics and supply chain also came to the fore during this time. The world has become smaller, people get goods from different places, but we saw that the supply chain essentially came to a stall for a while during this pandemic. Another challenge that I feel is worth addressing is the notion of trust and adequacy. So folks who do physics simulations are comfortable to have a notion of validation for their models. Here we are constantly asked, how sure are you that your model is right? And I can say, I can talk about it structurally, that the model is about right, but if you are used to physics-like validation, that simply doesn't exist in this world. So you're always challenged in a good way, and I would argue just because you fit your time series to the past data doesn't mean that your model is right. It's not that hard necessarily to do that. Future projections fitting is also, external validation is not enough, but we want to try and get faith in these models, much like weather models. Now in weather, the physics allows you to understand at least the basic structure. Here I would say we haven't reached a level of understanding, and I'm sure all of you who dealt with it feel this sense of challenge. And the last one, and then I'll stop, is a decision-making challenge. Everybody, in my opinion, is a decision maker, right? It's not just the mayor of a city or the prime minister or the governor or the chief minister. Everybody makes a decision. We make a decision whether to send our children to school, go to work, whether wear masks is part of decision making. And this decision making is done essentially hierarchically. Each decision maker makes decision within his or her context, and if you want to view it either pro-socially or strategically. But to come up with policies that cut across these levels of decision making remains, in my opinion, a big challenge to do. So in that context, I'll end by saying that where I think this whole area is going is this concept that I've called out now, P-cubed analytics. The 3 P stands for pervasive, personalized, and precision analytics. And the thought is that all of us now progressively feel the desire to have access to information. So there's a concept of pervasive computing by Mark Weiser, which stands for any place, any device, any time. And I think people want information to be able to make decisions in case of pandemics too. The phones are a very useful device there. They also need to be personalized to your context. So, what's happening in New York City is different than what's happening in Charlottesville, is different than what's happening in, say, Chennai. And so the context has to be taken into account, and then it has to be precise for the decision maker too. And I think apps and decision support tools that we make have to try and go in this direction. So we are participating, actually we are supporting the US-UK prize challenge on privacy preserving technologies. It's in the second phase, and the challenge seeks to develop solutions that are privacy enhancing but are helpful to the society. So there are 2 data sets that the folks who are participating in the challenge have. One is a financial fraud data set, and one that we have given on a virtual pandemic. And the idea is that people can build out these systems where there's a red team that will try to break the privacy aspect of it, and the other team that will build privacy preserving solution. And the problem that they're going to try and solve is estimating individual risk in a privacy preserving way on this virtual epidemic. The virtual aspect being that is a control, we can measure it at least in terms of how good the algorithms are doing. So I'll end with this, Ravi, so that we have time for questions. Thank you very much again. Thank you very much for coming. It's an absolute honor and a delight that you folks are here. Yes.
So in weather modeling, the trend is that you have a simulation model which kind of does analytics, and you combine it with deep learning models to do the forecast. That's the new thing that's going on. Did you see that happening in analytic modeling as well?
Yeah. So I think so. The two reasons that deep learning models have become useful, we have applied it also in. So as I said, this ensemble approach is the right approach. In fact, within our group, we have done ensembling already. So the overall ensembling is super ensemble. We have an autoregressive style model, which is largely statistical. We have agent-based models. We have deep learning models too. One of the challenges, of course, for deep learning models is sparsity of data. Unlike images or voice, you have basically one curve to deal with. So simulations can be used to train them. The term that people are using is knowledge guided machine learning or theory guided machine learning, which is how my student did her thesis on, and it oftentimes works quite well. I think it's still a very early part of the thing, but I think that might allow us to get faster forecasts because these simulations take a long time to run, as you know, Sandeep. So
Can you just tell us a little bit more about multi-scale simulations, so exactly what we want to experience?
Yeah, so in our simulations, the first is temporal scale, the scale of disease progression, the scale of interventions that we have had to model. There is also spatial scale. So the spatial scales also exist. We started just modeling our state, but now have started doing simulations over a social network that spans all of US, and it's for computer scientists, and for me that was particularly interesting. It's got 300 million node network with about 15 billion edges. So that's a scale where heterogeneity is absolutely present at the level of a county, from county to a state, state to a nation. But then the third heterogeneity exists in terms of behaviors and policies. The policies that one county is instituting, which is different from policies another county is doing. State level policies are quite different. One particular data set in that context, Sandeep, I should highlight, and I'm hoping maybe we should do this in India too. It's turning out that there is no record of various interventions that were put in place anywhere, okay, meaning a formal record. So finally, with our students and undergraduates, we have gone through the pain of scouring the web and doing the best we can for our state, county by county, in a temporal manner of all the policies that were put in place. And it talks to this multi-scale aspect of it. But I propose this as a challenge for folks here to basically scrape the web and build this, because 10 years from now, we would not have a good sense for all the policies that were put in place. It's lost. So my hope is that we can actually work on this problem. I think it's a beautiful computer science problem too. It might seem like just looking at the web and collecting, but I think the challenge is to look at dumps of the internet archive and writing machine learning techniques to essentially derive this out from there and then improve it through human engagement. Hopefully that helps.
I have one question. I think one of the key issues here is modeling the network.
Yes.
So how are you doing that?
So if you recall my first slide in the technical, whatever little technical discussion I had, was to build this network out. There's no real network, right? We have to synthesize. Rajesh has synthesized one now for Karnataka. I think Gautam is synthesizing one along with his team. Sandeep has done. And it's the way we had started doing this back in 2004 and early on is to take as much data as available and synthesize it together. So we take data from census, we take data from trip diaries, we take data for built infrastructure. We also work with Google. We have also worked with other service providers that have given us traces of mobility, but that has to be used very carefully. Google only gives aggregate data sets, but that data set provides you with certain details. I feel more and more of these data sets for mobility are available to build it out. getting behavioral data is much harder, but again, phone, exists. That's why this slide is, I think, very central. I think there's a lot of data that is collected on us through these devices, unfortunately, whether we like it or not, and more is going to be collected. And our view on privacy and our concern is very valid, but I think we can develop privacy preserving methods to get a sense for these behavioral representations without having to sacrifice individual privacy. And I think that's why I really think this is an important topic to consider. Okay, thanks.